I'm Mike Royer with an extended interview in this Health Matters Web Extra. Hello again, everyone. This is Mike Royer, and this is Health Matters here on WVUA 23 and on the websites of our station and the websites and pages of the University Medical Center here at the University of Alabama. Dr. Marissa Gigi is our guest today, Associate Professor of Psychiatry and Behavioral Medicine. Dr. Gigi, as always, it's good to see you.
Thank you.
We talked to you about a variety of topics, and they all deal with everybody and different age groups, and they're so informative. This one is too, but this is one that is, I think, easy for many of us to go, oh, that's not my problem. And that's a real crisis in our jails today that you see very often because you go into jails. What is the crisis that you want our viewers and listeners to know about?
Well, the main problem we have is that our seriously mentally ill people in our society are unfortunately being incarcerated instead of getting the treatment that they need. A large portion of them end up in jails because there's nowhere else for them to go, and they get arrested for very minor charges, often related to their mental illness. And so they end up incarcerated, oftentimes languishing in the jail, needing help.
Lest listeners and viewers think Dr. Marissa Gigi doesn't want anyone in jail. That's not at all what you're saying. There are criminals, real criminals, who have done real crimes and may be a danger or pose a danger to society. That's not who you're talking about. You're talking about folks that maybe didn't pay a ticket, or they didn't appear on time or respond on time. And those aren't truly criminals in your mind. They need help.
Correct. And a lot of them have addiction issues as well, or they have untreated psychosis like schizophrenia or some other serious mental illness, and they're on the streets homeless, and they may be disturbing the peace or criminally trespassing, which is a minor charge, and they end up arrested for something like that, loitering, and they end up in the jail very seriously mentally ill and sick, hearing voices, very depressed. One thing that's a big crisis is suicide is the #1 cause of death in jails. So it's something that's a big problem.
And at the time when they need help, the very last thing they might need is incarceration with others who have no understanding of what challenges they're facing. So they don't just get off the streets, their problems are exacerbated by that incarceration.
That's correct.
And so when you counsel in our jails, and you do, how can you help them? Because you can't bond everybody out that you go visit. You've just got to try to meet their mental needs. What can you do?
So what I do is I get referred people who have real serious mental health problems, like they're suicidal or very depressed or hearing voices, and then I assess whether they qualify for medication, and I'll do an evaluation, and if they are appropriate, I'll prescribe them appropriate medications, monitor them closely. And then we have a couple of group therapies for people with addiction and trauma, and so we provide some group therapy and counseling in our jail, and we also have a social worker who helps provide services that helps connect them with other resources in the community. So for example, if it's a veteran, our social worker will contact the Veterans Court at our VA to see if that person would qualify for services. We'll connect with our mental health center, we'll connect with community corrections to try to get these folks connected to other services.
Our tax dollars pay to keep people in jail. A portion of our tax dollars can also be used for the kind of help you're describing, counseling, medication, other things. I would assume in your mind, those tax dollars being spent to help alleviate problems rather than incarcerate are much smarter tax dollars than just caging someone up.
Well, if your goal is to prevent people from returning and not, repeating, getting arrested and becoming productive members of society, then yes, I think that would be for many of the dollars that are spent would be better spent on social services and prevention and helping people get back on their feet and getting the services that they need to be healthy.
Our police agencies here in West Alabama, Tuscaloosa specifically, and the Sheriff's Department, they're not doing anything wrong. They're just doing what they're told to do, correct? Where does the change come? Do we need our elected officials to look at, we're going to take a hard look at changing the way we treat repeat offenders of minor violations?
Right, it has to come at the legislative level and where we put our spending priorities. And it could be a shift in some of the priorities, but I want to say that the people I work with at the jail are very supportive of what I do, the
Sure.
sheriff and the deputies, and I have a lot of respect for what the police and the sheriff's office does. So they're doing their job, they're working as hard as they can, but they have a very difficult job as well because many of the calls they go out on are for people who are seriously mentally ill. So we do have some deputies that are mental health deputies, which is great. And sometimes those folks should go to the hospital and not to jail. And we are doing that more and more than in the past. So I'm really happy about that. But more shifting on priorities on those types of things, prevention, jail diversion. But it has to come from a legislative level.
Have you ever been invited to testify at in Montgomery before the elected people so they can hear? There's very good people in our legislature, but they're not knowledgeable about this like you are. Have you ever found a way to share what you know about this in front of elected officials?
No, I haven't.
But you'd be
No.
happy to do that if invited.
Yes, I would
assume.
if I was invited, yes.
Well, I would love to see you and others with your expertise do that, because if we're going to solve it, those elected officials have to know about it first. So maybe those of us watching and listening might tell our elected officials, bring some pros down that know what they're talking about, and let's see if we can help these people. I look at the Tuscaloosa County Sheriff's website and see the same pictures posted each time someone's arrested, same offense each time, and I keep wondering, can't we help them instead of just putting them back in jail? And the answer is we don't always help them, and you'd love to see that change going forward.
Yes, I would. And sadly, I'm probably the most consistent psychiatrist that many of those folks have ever had. I've had the same people over and over again. I've been there about 7 years, and it's just, you know, I see them at the jail, and it's not really an ideal location to treat someone with mental health problems.
Something may be wrong when, as an employee here, I can pay a very small copay and come see you anytime I want. As much as you can schedule me, I could make a regular appointment to come visit with you and talk about my problems. Those folks, most of them, maybe all of them, don't have that benefit, do they? They only see you when you're called by the officials to come talk to them. Need to change that too, and can we?
Oh, that's a bigger, more complex problem.
I know. Well, see, I expect you to solve all of our problems. But again, that's back to legislative action and making professionals like you more accessible.
Right, right.
We better not ignore this. In closing, your thoughts about that, we only will compound the problem if we just brush it off and go, well, my loved ones aren't in jail. This isn't a problem of mine. Your final thoughts on that?
Well, this problem's not going to go away.
Yeah.
People who are seriously mentally ill don't just disappear. So when we closed down a lot of the beds at the state hospital level and, you know, sort of cut back on funding for community mental health, you know, it's magical thinking to think that these folks are just going to disappear. They end up on the streets and they end up arrested and re-institutionalized, but oftentimes in correctional settings. So it's not a problem that's going to go away, and the money gets shifted to the local level because jails are paid for by our county and city tax dollars.
Dr. Mircea, thank you for what you do in this area to help those you can help, and maybe we can help more people down the road just with more knowledge and maybe the influence we have on our elected officials. Dr. Mircea, thank you for your time.
Thank you so much.